right, well, it's 4:01, so we're going to get started. Welcome, everyone. Thanks for joining us. I hear some feedback, so I just want to reiterate the request from Lori that we mute so we don't have that. But thanks, everyone. It looks like we're getting continually increasing attendance at these. And also, thanks to everyone who utilized the email forum FAQ inbox to give us requested topics. Hopefully you'll see that that was purposeful, as we're going to make sure we cover all of those today. So really quickly, I want to cover who is here from Ddsn. I know you can see us, but we're little on the screen. So Michelle Fry, State Director.
Lori Manus, Associate State Director of Policy.
Sorry. PJ Perea, Public Information.
Janet Priest, Associate State Director of Operations.
Harley Davis, CAO.
Tracy Hunt, CFO.
And we also have some Ddsn team members who are joining us virtually. If you all will say hello.
Andrew Thayer, Director of Engineering.
Hi,
Debbie
this is Ann
Ponzaruto.
Dalton, Director of Quality Management.
Debbie Ponzaruto, Director of Finance.
All right, thanks everyone. Well, with our introductions, I want to pass it to Lori and Margaret to talk about direct billing.
Margaret Alwan and Jeremy Falkenberg are here from the Department of Health and Human Services. Margaret, I'm going to let you guys go first, and then I'll kind of piggyback on anything you don't cover from our end.
Great, thank you, Lori. And let me see if my audio is working.
It is. We can hear you great.
Great, thank you. So here we are 1 month in after our go live date for direct billing. I am happy to report that the vast majority of claims that have been received into DHHS have paid appropriately. I'm stealing Jeremy's thunder here, so jump in, Jeremy. But we have to date through the end of April received over 107,200 in claims total. Of those, 99.8% have paid. That's a huge feat, I think, when we look at all of the training, all of the setup that I know all of you providers have had to do to put this into place, to get accustomed to some new processes for many of you. So again, congratulations to the entire team in working in collaboration with us to ensure as seamless a transition as I think could have been possible with this magnitude of a change. So again, great results thus far for those claims that have been received in the system and paid. So just wanted to give a recap of claims received, those that have paid. And again, we are continuing to monitor any issues or situations where we see there may need to be outreach. Big shout out to Jeremy's team. They have been very much ready on the spot to reach out and address when we see some anomalies with the billing or any corrections that may need to be made. So again, great results thus far for claims payment. I'll stop here and see if Jeremy has anything to add.
You hit the highlights, Margaret. The providers should be very proud of themselves. These numbers are beyond my wildest expectations. In fact, they are higher than the more traditional providers who deal with claims every single day. So seeing 99.8%, you all did a phenomenal job, and thank you so much for the work you put in for this.
Thank you. I know that there are some questions that we have had coming in terms of cost reporting and the timing on that. So we are establishing some dates for a meeting to go through with our reimbursements director as well as other leadership, what the expectations are around cost reporting templates associated with that, and timelines through which we will review rates. So I know that's a hot topic. Meeting dates we're looking at in a couple of weeks out to give everyone adequate notice. So just a heads up that that will be coming. Lori, I had a couple of other updates. You want me to go ahead and do that while I'm talking?
Absolutely.
Okay. So we also did provide some high-level updates on the Medical Care Advisory Committee meeting earlier today. Part of that included updates on the American Rescue Plan Act and the HCBS, or Home and Community-Based Services portion of that funding. We outlined actions that had already been completed. Much of that is waiver renewal and amendment actions to enact new services, enhanced services, rate increases, and utilization of ARP funding. Actions that are in process. We are actively working on distributing funds identified in the spending plan for staff retention in home and community-based services. A thank you to several individuals that joined a work group this Monday to help inform how we distribute that additional funding, and making sure that the way that we do it is supportive of the provider network and stability in the workforce. So we really want to focus in on retention. So we got some great input from a diverse perspective of providers first thing this week. And we're working actively on the methodology and timing for distributing additional ARP funds. I will also mention that in recognition of hurricane awareness, that we are actively looking at the approach for hurricane planning. Ddsn has shared with us information related to hurricane shelter agreements that have been in place, as well as some proposed options to address, should the need arise through a natural disaster, what we need to contemplate in terms of those hurricane agreements and preparedness. So we're actively looking at that. Wanted to make mention of that. Lori, those were my main topics I wanted to speak to. So I will turn it back over to you.
Great. I don't have a lot more on top of what Margaret kind of presented to the group. It has been a big effort to get direct billing off the ground. And we have, we've worked really closely with Health and Human Services to try to address any issues. Many of you have reached out to me about individual situations. I've tried to be as helpful as I can. If you're awaiting a response from me, I'm about 2 days behind. So just know that I'll get to you when, as soon as I can. But we've had a few little bumps where we've had to try to help folks with how to get authorizations in place and that kind of thing. So other than that, I think we're good. We do have the ability now for those of you who have state-funded services for you to submit the state-funded services invoice to DDSN. As a reminder, we sent out a memo, I believe it was about mid-April, that told you how to submit that invoice. So make sure you refer to that memo. You have to run a report in their app. You have to create an invoice. You have to upload it on RBC or something like that, right? I can't remember the exact process, but make sure you follow the process when submitting those. Anybody have any questions? So there is a question that says, when can we expect responses to single case agreement request? Margaret, do you want to take that?
Yeah, I'll be glad to, Lori. Thank you for that question. We did meet last week for those agreements and the supporting documentation that have been submitted. We are in final review of that information, and we anticipate that those will be forthcoming in short order.
As a reminder, there is now a single case agreement directive that is active. Our commission approved it last month. If you have questions or need to submit a single case agreement, then please follow that directive because it kind of runs through us to HHS. The ones that were asked about were ones that were completed prior to the implementation of that policy. So, do we, Tracy, this is kind of for you and your folks. Do we need to do separate invoices for each state-funded service, or can they all be done in one invoice?
Debbie, are you nearby? Are you okay with them combining everything? I don't see a problem with it.
No, I think that will be fine. They just need to make sure that each piece is separated.
Fantastic.
Keep in mind too that those state-funded invoices are for a month, right? They need to be done for a month at a time. Someone asked that we resend the April email with instructions for state-funded, so we can absolutely do that right after this meeting. So expect that we'll just resend what was sent out so you know what to do. Nikki says she tried to run the report for the state funded. It is blank when I run it, but the attendance has been recorded. So I know that there was a problem with the report yesterday. My understanding is that the report has been updated. So we really need to make sure that you're able to run it today. If you're not, Nikki, if you'll reach out to me, I'll reach out to Therra. There was some little glitch in their system yesterday that the report wasn't working. Margaret, we have another question about single case agreements regarding the retro date and when it will be retro to.
Yes, so we will be looking at these on a case-by-case basis based on the information submitted and the timeline with the supporting documentation. We anticipate that based on the go-live date and the changeover to direct billing, April 1st will likely be our earliest date that we will retro these requests. We want to recognize that individuals have reached out early on, so we anticipate April 1st. But again, we're looking at these on a case-by-case basis.
Can a provider request a tier or rate increase for residential state funded based on staffing needs? So for the state funded people, we are treating them just like the waiver people. So yes, you can request a tier change, but the tier change will be evaluated based on the definitions for the tiers that are in the waiver. So yeah, you can ask for state funding. Does DHHS have an update of the accounts being separated on the DHHS portal for EI and waiver services? Margaret, that's for you. That's about the same accounts.
Yep, and Jeremy, please feel free to jump in if necessary. So there are two considerations here, I believe, with this issue. One is now that the remittance advice should be going back and available, particularly in TheraP, to be able to identify those services and identify which are EI and which are waiver services. The remittance advice is one avenue to look at that. We are looking at options in terms of the web tool remittance advice. We have gotten feedback in terms of the format in which that remittance advice comes. So we are taking a look at any available options. And I know there are some folks that are independently looking at software options that may be able to take the format that the web tool remittance advice is issued and put it in a format that is more readily worked with, to use a technical term, in identifying which of those services are for which set of services. Jeremy, anything you would like to add?
As always, Margaret, you hit the nail on the head. We are looking at some options as far as the output. We're also looking at some internal options of software that could possibly take that PDF and break it down into a more usable format. We continue to have these conversations with our IT department and with Clemson University that runs the remittance. We hope to have more information for everyone shortly.
Margaret, one more question. And this is for Jeremy, probably you more than Margaret. Is there a process in place to request enhancements in reporting available on the web tool? I think what they are asking is there like a mailbox that they send?
Yeah, so the web tool itself is not a reporting application. It is a claim submission tool and a means in which to get status of a claim or to pull, remits. If there is something that someone would find, helpful to them, we're always happy to take suggestions to see what we can do. We have that ongoing mailbox. Margaret, I forget the exact, it's one that your team has been monitoring.
Yes, and that would be the appropriate place to send
Yeah.
those. That's Medicaid waiver at scdhhs.gov.
Yeah, and Margaret's team will route those to me, and I'll be more than happy to take a look. And if there's something we can do to make everyone's job a little bit easier, we're happy to explore that.
So we have another question about this whole idea of creating a new account for the funding to go somewhere differently than the EI money. I think like the user is saying they created a new account, but it's not currently being used. So Margaret, I don't want to put words in your mouth, but I think the option of a new account is like a totally new EIN number. Is that so? So the issue is you can have 10 Medicaid IDs, but all of the money from those 10 Medicaid IDs are going to go to whatever EIN number is on file for your agency. So if you use the same EIN number for all the 10 Medicaid accounts, then all your money goes into that account. If you wanted it to go in a separate account, you kind of have to have another EIN number. Is that accurate?
That is absolutely correct. You'd have to have a different EIN and a different MPI, of course, for that EIN. But the EIN is the driving factor there. Yes, ma'am.
How do I submit a question chat?
Okay. I think that is that's it for the questions. All right, well, Margaret and Jeremy, you guys are always welcome to stick around, but we'll move on to some of the other portions of the agenda at this point. If we get other questions, we'll field them whenever they come in.
Thank you. Everyone have a nice day.
Wait, there is another question. How do we see LASRI payments under our MPI number? I don't even know what that is, so.
I think Jeremy may have dropped already, but I will be glad to send that question his way.
Okay, that'd be great. Thank you. All right, the next item on the agenda is an EVV updated. I just wanted to let you guys know that EVV obviously has been delayed. We are still working towards trying to get EVV implemented, but at this point we do not have a target date that is being published. Just a reminder for those of you who provide services that will be covered under EVV, and that means companion or respite at your location as the provider of record. At this point, you would be billing for those services using the web tool because there's not an availability to bill those services through their app. Any questions about EVV? Somebody put a link to the memo about state-funded services in the chat. Thank you very much for whoever just did that. So that's where you can locate that memo. The next item on the agenda is leave days. As you guys will recall, I sent a leave day report out last month around, I think it was around the 10th of April. We will do the same in May for March and April. And we will send it out, you know, probably somebody from here will do it until we can get that report available to you in the TheraP account. TheraP is having a little bit of trouble getting it into the provider account just because of the way things are set up structurally. So we may have to do it this way for a few months. If you have questions about leave or leave days or how many somebody has or whatever, you can always reach out. I'll be glad, you know, to update things for you. There's a question that says, are we still billing companion services through paper or can we bill on the Medicaid portal? You can absolutely bill on the Medicaid portal. You cannot bill them through paper. Like the whole days of ISRs, that's gone, right? You're not sending us anything. We're not paying you for companion. As of April 1st, companion went direct bill as well. So the only way that you can bill for those are through the Medicaid portal. Robin said, who are the leave reports going to? They're going to the executive director. We don't have great information in SPM about finance directors. We tried to look for it to make sure that we had it for everybody, and it's kind of spotty. So we're sending them to the ED and you know, asking them to share it with whoever needs it. So you might want to let your EDs know to please check for this leave report. All right, if there are no other questions for me, the next item on the agenda is the ICF rate update. So I'm going to pass it to Tracy.
Good afternoon. Last week, we sent out an email and a memo letting everyone know that the community ICF and IID rates had changed effective May 1st. One of the questions that we got, and we explained in the memo, how it was going to be calculated with the administrative rate being at a certain percentage. And that percentage and fee was calculated once we put in the rate and sent that out. That was something that we made sure that everybody was going to be able to understand moving forward what the rate was going to be. The other thing we wanted to make sure everybody knew is that band payments are being processed this week. They were delayed just a couple of days because we were working on an effort to get this out. So you should be able to get payment by the end of the week. We will be going retrospective in the future, but we've got to work out some communications and how we're going to do that and when the timing would be the best to do that. And of course, we're going to work with HHS before we move forward on doing anything on how we're going to do that. But right now, we're having reconciliations being done for January through April to make sure y'all get that rate adjusted, as well as the band payments that are paid this week at the end of the week. So does anybody have any questions on the ICF rate? Yeah, great, thanks, but that might have been for you. Okay, if there's no questions, or if you think of one later, I can always speak back up. Oh, our client fees, part of the rate. Is he talking about bed fees, Lori?
No, I think they're talking about client care and maintenance. Yeah, care and maintenance.
Am I up here?
Is that the same person? I'm sorry, I can't keep track of the questions.
They're asking that maybe address the questions that you answered in the email
Okay.
Right.
that you want sent to Tyler.
Sure, I'm sorry. Let me pull that up. And I want to make sure Tyler actually sent an email and he was asking questions about making sure he understood how the rate was calculated. And I just want to make sure everybody knows that the 4% reimbursement to DDSN is not covered by the administrative contract. Bed fees, one of the questions he asked, they're $8.50 per person per day. And that's how that calculation, if you take that, then that's how, just so you'll know for your benefit. DDSN receives less than the $337 by the care and maintenance, and I hope that answered the question that just came up. Because we're paying the boards $360 or $322, DDSN will have to retain the balance of the client's SSI, or DDSN would receive far less than the $322 that we're paying out. And those are some of the questions that Tyler had asked. I'm glad you did, Tyler. I meant to go over those, but was running straight through the memo. Let me go back. Do y'all see any more questions? that I
Yeah,
haven't answered?
so Melissa says, the memo says effective May 1st, but is she correct to understand the rate is effective January 1st? So yeah, Melissa, the rate's effective January 1st. What's gonna happen is from January to April, you guys are gonna get a reconciliation based on what we already paid you. Effective May 1st, you're gonna get this new payment with the 322. The reconciliation will also use the 322. We just didn't pay you that from January until the end of April. I hope that makes sense.
It did. Thank you, Lori. Okay, if y'all think of any more, I'm gonna let Andrew move forward. He's gonna give y'all an update on the owned properties.
Hey, good afternoon, everyone. And for those of you guys who don't know me, I'll introduce myself again. My name is Andrew Theron. I'm the engineering director here at DDSN. This update is really for the providers who operate the state-owned facilities. We've kind of dubbed them as the 59 properties. We've got some community residences, some day programs, and administrative buildings in that set, but most of them are residential. Those of you who do operate those homes, as you know, last fall, we did a site visit to each of those facilities. We met most of you guys on those trips. And what we were doing was we were assessing those properties to the old 300-05 directive and really looking at some deferred maintenance items that DDSN had traditionally been responsible for under the old version of the directive. At the time, there was a lot of talk about selling or potentially rolling or transferring these properties. That was kind of at the time we've kind of really reassessed that property or that policy. And I think DDSN does feel that we are responsible for these properties, and we do intend to maintain them. Right now, we're in the process of drafting a directive that's going to kind of state how we're going to maintain these properties. So I don't want to go into too much specific detail now on what's going to be covered, how it's going to be covered, but just kind of want to give everybody an update that something is coming and it's in the works. When this thing does go official, we'll put it out there. Everybody will have a good idea for, what it is and what it covers at that time. And what we intend to have is essentially a way for people to make requests. We think probably we'll have a dedicated email or something like that where maintenance requests can come in. Right now, we want to say don't wait on us. If you have any major maintenance items that need to be taken care of, please move forward on them. But also save all your documentation, your quotes, your invoices, and justifications for the maintenance or repairs that you do because we'll be looking at those as well. If you want to reach out to me in the meantime, before we get any type of formal email set up or anything like that, please feel free to do so. But just wanted to give everybody an update that is coming. I know there's been a lot of back and forth on these properties, but I think we've kind of got it moving in the right direction. So look forward to something coming out here in the near future. And I don't know if anybody's got any questions on that or not.
Okay, so Andrew, there's a question that says, is there an intention for DDSN to retain ownership of the properties long term?
I can take that.
Yeah.
Sure. So this policy update, for lack of a better term, is not about intention. If there are providers who want to take ownership of those properties, that's not off the table in any way. We just want to ensure that we are complying with the proviso that was passed last year. So this is keeping ownership really on the side, but really just about ensuring that the maintenance is performed as it should be under the law. And as we get further along in conversations under the policy, if there are individuals who, pursuant to that proviso, would like to take ownership by signing a voluntary MOU, and then we have to take it to SPA for approval, then that is certainly allowable and encouraged. We just want to make sure that we're providing the maintenance as we ought to be doing under the proviso.
Okay, there's a question related to ICF. I'm gonna skip and go back to it and stay on this, this agenda item first, and then Melissa, I'll come at your question in just a second.
Yeah, and I will add that just from our site visits last fall, again, we've got a pretty good list of a bunch of needs out there, but again, I know that's several months old now. I'm sure there are new items that have popped up. If anybody has anything like that, please email me, let me know. I'll add it to the list, and we'll be reaching out to handle them. So
there's a question about whether upgrades such as tankless water heaters can be done and paid for.
yeah, I mean, I think we'll be looking at any type of upgrades like that. I mean, if you need a new water heater, it's certainly not out of the question to upgrade to a tankless one. That would depend on a lot of things at the facility, but I don't think something like that is out of the question now. So.
And then there's a comment that from an accounting perspective, providers will need to know if these are to be reported on their cost reports or captured as an expense. If we're paying them back, then it needs to be accounted for properly. So I guess.
Yeah, I mean, it's got to be captured as an expense, and I mean, it has to be reported if we're reimbursing them as well.
So just be.
Yeah, I mean, both need to be reported. But DDSN was recouping insurance premiums from providers that you are all paying for us. I don't understand that question.
So it sounds like DDSN was paying insurance premiums maybe on these houses. I don't know.
I
Go ahead.
can answer that.
Thanks, David.
2 years ago, we recouped the insurance premiums for the homes, the 59 homes. The decision was made last year that we were no longer going to do that. So no, we have not done it for this past year.
So there's a question about when Andrew came out, he was really looking at roofs, HVAC, sprinklers. So there's a question about what if modifications are needed to bathrooms and kitchens. Yeah. I think the individual things go through you, Andrew, is that right?
Yeah, the directive, I can tell you that we are going to try to address certain things like improvements and renovations, as well as repairs and maintenance. So all of that is being kicked around right now when, you know, in the directive. So
there's a question about whether we anticipate charging providers to use those homes as part of the new policy.
The only, our hope is to begin recouping 50% of the care and maintenance, room and board. I knew I was using the wrong word as I was saying it.
I didn't know. I haven't been involved.
Room and board. We've been talking about care and maintenance.
I know.
We're going to recoup 50% of the room and board only. And now that would no longer occur if a provider wanted to take ownership. But we are planning again, 50, I see that, 50. We are going to walk through all of this in the policy that we will take to the policy meeting, but we knew we were getting questions and wanted to bring everyone as up to date as possible.
If a change in ownership, Andrew, will you be reaching out to those state funded providers?
I don't think we intend to change ownership without anybody's without notifying anyone. So no, I don't. Yeah, I think in most cases, providers would be approaching us, wanting to roll or sell the property. We're not looking to offload them right now. So.
How can we access the recordings from the meetings? I will ask Christine Lake on that because I don't know where these recordings end up being housed. I think that's it. All right, I'm going to go back to Melissa's question. Her question is related to ICF rates. Would DDSN consider waiving the admin fee charge even with the increase? The ICF rate is very low, especially when you adjust for day services that are included in the rate. I think that, I don't want to speak for the agency, but I think we want to work with the Department of Health and Human Services about transitioning ICFs to more of a direct bill kind of service. And at that point, there wouldn't be any administrative fee. The program is very, it is a big administrative burden. I'll just say that. There's a lot of administrative work that goes into the ICFs. A lot of paper changing hands, a lot of reconciliation, a lot of review of turnaround documents. So I don't know that there's a way for DDSN to cover that burden. That's just my opinion. All right. The next item on the agenda is you, Janet, residential availability survey.
Yeah, so as DDSN has historically kept track of all bed vacancies. So we know where vacancies are. What we don't always know, or we don't really know, is if some of you have made decisions to not fill available beds, or if you are intending to open new beds, which would be great. So what we intend to do probably by the end of the week is to send out a survey to just get some feedback. It's a very simple survey. It's about 6 questions, and this is for residential habilitation providers only, to get information about what you intend to do, what your intentions are. So over the next 24 months, are you currently holding any beds or not filling beds? And if so, kind of why? If you intend to open any beds, do you intend to target specific populations or people with specific kinds of needs? So we're just hoping to get some information back on that. So you should be seeing that by the end of the week. Just look for it, and we would really appreciate your feedback. This didn't get on the agenda, but I thought about it after the fact, so I'll go ahead and say it. We are updating the DDSN application portal, and on that portal, we will be adding a tab where you can go, case managers can go, to look at things like bed vacancy reports. Case managers can go, or people can go, providers can go and look at people who are living in regional centers but seeking community placement. So the old quote Olmstead list. And then we're also going to make available the listing of people who are in need of residential services. Again, the old critical list, but we will have those reports available. Right now we're sending those out, and sometimes people don't need them when they get them and they need it later. So they have to ask for it and we have to send them. This will just be a way so that the most recent information about vacancies will be available through the application portal. It will not include people's names. It doesn't now, but it will have the contact information for people. Soon, we are hoping to expand that list a little bit so that case managers can let us know when people desire a different living option than they currently have. When we do that, we'll start adding those names. And we're also hoping to expand a little bit. So if a residential provider anticipates a vacancy and wants to advertise that vacancy, then they can have that added to the list so that people can see what's available and plan for it. So that's my update.
So I think Jason is recommending, Janet, that in the survey to include something about whether the vacant beds that may not be filled are specific to staffing deficits under the ESL.
Yeah, that's in there. It's in there.
Okay, good.
We're looking for the reason. Well, if beds are not being filled, we do want to know the reason. We added a couple that we believe may be the case, and then you can comment on anything beyond that.
There's a couple of questions about the state-owned, the DDSN properties.
I think.
You know, basically whether or not we're going to charge for day program admin or ICF.
At this point, we have shared the information that we anticipate. We are going to continue to be working on the policy, and we will update you all with information as that goes. Obviously, that policy also has to go out for comment.
It does.
So we look forward to continued conversation.
All right, next item on the agenda is upcoming events. PJ?
Thank you. So for this month, it is Employee Appreciation Month for DDSN. So we are doing a number of things with our employees this month, you know, showing them how much we appreciate their hard work and dedication. We will also be involved with the South Carolina Special Olympics. They are having their statewide event this weekend at Fort Jackson. We will also be involved with the Mary McLeod Bethune Festival in Maysville on the weekend of the 21st and 22nd. Beyond that, we are looking into other opportunities to interact with the public, looking into things like the South Carolina State Fair and other local and regional activities that we can interact with families and our consumers and the public and get the word out about DDSN and our programs. If you have any events or any ideas that you may want us to be involved with, feel free to contact me or send me an email. Or if you see any news items that might be of interest to us, definitely send those to me. I like to stay informed of what's going on throughout, our network. I don't get to see everything, but I do appreciate when people send me things. Any questions?
I don't think so. Next on the agenda is admission, discharges, and transfers. I think we have Ann Dalton remotely.
Yes, thank you, Lori. So as a reminder, I just wanted to talk with everyone. I know that there are a lot of staff changes going on, and I want to make sure that everyone understands the process for admission, discharge, and transfers. Whenever providers have identified a person for admission, there is a form that must be completed on the DDSN applications portal. That is the ADT form. This is typically completed by the residential service provider. But it is very important that the case manager or their supervisor also acknowledge these forms. And that is on the DDSN applications portal. They will receive an email from the system, and it's important that they acknowledge that those forms exist, because changes in placement may require new authorizations to be submitted. And we need to, that's been a gap that we have observed over the past couple of weeks, where case managers have been left out of that process. So once the forms are submitted to DDSN, we have an admission discharge transfer coordinator, that is Patrina Dawkins. She will be updating and approving the ADTs, or in some cases, she will be placing them on hold if there is an issue with the license capacity in a setting, or they're waiting on waiver enrollment, or there's some other reason that has to put the situation on hold. Otherwise, the ADT will be processed and sent on to cost analysis for approval. Whenever you have a transfer, the same process will follow. The sending provider will initiate that ADT form. The case manager will also need to acknowledge it. Whenever there is a discharge due to death, we do need for the case managers to complete, they need to close the case on the system after the death report has been completed. So if you have any questions about any of this, we have a new email address that we have set up, and that is adt@ddsn.sc.gov. So we're happy to answer any questions. Please direct any questions about ADT to that email address.
So Michelle is asking about the new process for authorizations for changes in residential. Right now, we kind of have all kinds of people watching that ADT process to make sure that a new authorization is issued when needed. It is new for everybody. So what I'll tell you is, if you need an authorization that you don't have, you just need to, you need to let somebody know, right? I've helped a couple people, if you send me an email that says I need an authorization, I usually try to sift through and pull those first. We are working on a full policy with a process that I think will make this a little easier in the long run. Part of the problem with ADT is there's an approval and then there's a move date. And sometimes in the past, the approval had to happen, but the move date was kind of up to the provider and the person, and nobody really got involved at that level. And now it's super important that the case manager knows before somebody moves that they're going to move, even if it's been approved. Because if they don't know, they can't send you an authorization. So that's kind of the whole, we just really have to make sure that we bring that home.
Thanks, Lori. So next on the agenda, I wanted to talk a little about the abuse, neglect, and exploitation reports, critical incidents, and death reports. I feel like I sound like a broken record talking about timeliness in reporting, but it is so very important that providers get their initial reports in within 24 hours or the next business day for all of the settings except for the CRCFs and ICFs. And of course, those are for the, those reports are due within 24 hours. The date of discovery is the date that anyone at your agency becomes aware of an incident or an allegation. So it seems that there's been some confusion with providers in understanding that the date of discovery is not the day that they receive the SLED intake. The date of discovery is the date that anyone, whether it's a DSP, the supervisor, or the executive director, if you know that something happened, it needs to be reported within 24 hours for the next business day. And then for the final reports, they are due within 10 business days, unless, of course, it is a CRCF or an ICF. And in those cases, it's due within 5 calendar days. So if you have any questions, please reach out to us. We have a different email address for those questions, and that's qualitymanagement@ddsn.sc.gov. One other thing related to the incident management reports is the topic of addenda. As a reminder, addenda are required whenever your agency receives updated information regarding the status of a report. So when you receive case closure letters that are from the Ombudsman's office, as a particular example, an addendum should be completed at that time to update the final disposition. We understand that it can take quite a while to get the disposition or the case closure letters from law enforcement. The Ombudsman's office is generally a little quicker in getting back to you. So whenever you receive that case closure letter, please go in, submit an addendum, and update that final disposition status. Thank you.
There's a question in the chat about authorizations and backdating, and I just want to say that authorizations are not new. They have always been a requirement for any Medicaid service. You have to have an authorization before you provide the service. So as Medicaid service providers, you have got to make sure that you have an authorization before you begin serving the person. It just needs to be a part of the process, a step in the process. So we really can't, backdate authorizations. In fact, the system was built to not be able to backdate authorization. As part of the implementation of fee-for-service, Chris is kind of saying Medicaid, what used to happen is DDSN billed what they could, but always paid, right? So that's what happened in the past. In the past, as providers, if you didn't have an authorization, we just kind of gave you the money from state money, and then we didn't bill Medicaid. Well, now we're not the provider anymore, and there's not money floating around up here for us to give out and bill what we can, right? So we've even implemented authorizations for state-funded services in the system. So if you don't have an authorization for state-funded services, when you go to run that report and send your invoice in at the end of this month, guess what's going to happen? The person's not going to show up on it. Authorizations are super important. You've got to have them. So there you go.
We had a couple of items come into the forum inbox while we were, right as this started, and I passed them to Harley. So I'm going to add Harley to additional remarks.
So I'll do the second question first, and then the first question some others might have input on. But the second question received was, what is happening with the selection of one or more assessment tools to be used for determining funding levels for individuals served? So the agency is putting out a request for proposals related to this specific area. So we will be working with subject matter experts to identify a tool or suite of tools that will help us or will be utilized for the consumers that we serve to tie into level of need and the services needed, and then that can then be used further down the line to determine funding levels. So it's a multi-step process, and Dr. Fry, if you want to add anything to it, but you can. But again, we'll be working with subject matter experts and a contractor to help initiate that process to then be implemented within the agency and piloted and things like that. So I hope that that provides enough information, but do you have anything additional to add?
No, we already had one RFP, and we are revising that and reissuing it after soliciting some market feedback. And we're excited to move this forward in a way that reflects best practice.
So the other question is a bit more general, and so of course, if you have anything to add, Dr. Fryer, and on the call, please do, or anybody else in the room. But the question is, what is happening in the area of quality development standards, indicators, and overall improvement of services provided? So this is a really general question, but from my perspective, I think that the goal is to really use the data that we have to help improve all these areas. And so part of the reason I was brought on board, I think, is to help synthesize some of that information and facilitate the use of data to improve all of these things, right? To improve the quality of the services we provide, and to really assess, the standards and indicators that we're tracking. Are we really capturing the information that we want to? Really focusing on, person-centered metrics. And so I'm obviously new in this role, but those are the kinds of things that I know are goals for this agency and things that I want to help the agency accomplish. Does anybody else have anything to add?
Well, thank you everyone for participating. I think that these have been really productive. And I want a special thank you to everyone who sent emails to the inbox to help populate the topics that we're covering. We want to address the questions that you have. And we look forward to seeing you all at our upcoming commission meetings this month.
Yeah, just a couple questions and comments are coming in related to authorizations. And I just want to reiterate to providers, I understand that you have a lot of risk related to authorizations. You really always have, and every provider of Medicaid waiver services has that same level of risk, right? The Medicaid rule is you can't provide the service without an authorization. Now, I understand that sometimes case managers aren't responsive. They're hard to get in touch with. We're currently trying to staff up with some state level case managers who can help you. If you're running into an authorization, you need an authorization, you don't have it, at this point, you need to reach out to me, Jennifer Jakes, or Melissa Ritter, and we will do what we can to get you an auth. I have not had a situation yet where if a person contacts me before not knowing before they provide the service, they don't have it, that we haven't been able to be responsive. I've done one at 8 o'clock on a Friday night, right? So I want you to understand that we're not saying if you don't have an auth, you can't bill, we don't care, right? But at the same time, I can't just sit here and say, it's okay to not have one. We're going to use state money anytime you don't have one. So that's kind of the bottom line with it. There's a question about an opportunity for in-person meetings in the future.
Oh, yeah. We would absolutely invite in-person participation if there's an interest in that. I'm looking around the room. We will talk internally about what room to use, but we'll kick that off with the next one and figure out space. And if anyone wants to come in person, we would happily invite seeing you all. So thank you for your interest.
Who's overseeing the HCBS setting at DDSN? That would be Janet Priest. All right, thanks guys.
Thanks everyone.